literally anybody can get cancer. Thinking about your future, thinking about if you're gonna have one. I think emotional healing doesn't have a timeline. Hey y'all, happy AYA Cancer Awareness Week or Young Adult Cancer Awareness Week. I have my Cure Them All t-shirt on. My friend Lexi makes these t-shirts, so if you want to get your own, I'll link it in the description box below. I'm so excited for this video. I'm going to be sharing with y'all a few facts about young adult cancer, and I'm also going to be answering your questions. I think the best way to spread awareness is answering questions that you guys actually ask, so I think this video is going to be really informative, especially if you aren't familiar with the cancer community. I hope you learn a little something in this video. So I do want to start off by giving some facts about young adult cancer. AYA, adolescent young adults, range from 15 to 39 years old, so there's a wide range, and it only accounts for about 5% of cancers, and that doesn't seem like a lot, but there's actually a huge community of patients and survivors, including myself, all over social media, all over the world. Every year in the United States, 89,000 young adults will be diagnosed with cancer. So it's super important for me to spread awareness on this topic because I am a young adult cancer survivor myself. I had lymphoma. When someone is diagnosed with cancer as a child or as a young adult, there are some long-term side effects that you have to worry about. Heart problems, secondary cancers, infertility is a big one. Those are the three main long-term side effects I'm aware of, but I'm sure there's more. And one thing I also want to mention is to know your body, because a lot of people think that cancer is only for older people, but that's far from the truth. Everyone can be affected by cancer, babies, children, young adults, elders, anyone. And it also doesn't matter how healthy you are, how much you work out. Literally anybody can get cancer. I was an athlete in high school. I had a pretty balanced diet and I was very, very active. Doctors still aren't really sure what causes lymphoma, so my oncologist literally just said that it's just a case of really bad luck. So random and spontaneous. It's nothing that I did, and that's something that I really struggled with. I really went and played back the past couple years of my life thinking, oh, did that cause it? Did that cause it? And that's just not a good thing to do. If the doctors tell you that it was spontaneous and it's something that you did, I tried not to worry about it too much, but I think it's something that every cancer patient thinks about, like, did I do something to cause my cancer? But you can't really blame yourself for it. So yeah, it's really important to know your body, to listen to your body, because when I was having all my symptoms, I kept pushing it off. I kept finding other excuses as to why I was having these symptoms. A few of the most common cancers in young adults are thyroid, breast cancer, leukemia, lymphoma, and melanoma. I want to get into the Q&A portion now because I got some really good questions that I think are gonna be really informative for you guys watching this video. One of the first questions I got were, what were my symptoms? My symptoms were shortness of breath, a dry cough that lasted too long, like months, arm swelling, and extreme fatigue. I was so tired, taking multiple naps during a day, which was not normal for me. Another really common symptom that I've heard my other cancer friends have had is night sweats. I didn't experience that, but I still wanted to put it out there because it's one of the more common symptoms. What was the scariest thing about being diagnosed as a young adult? I think the scariest thing about being diagnosed as a young adult is having to think about death, which is super dark, but it's true. Like, you're thinking about your future, you're thinking about if you're gonna have one, thinking about the long-term side effects. You think about, am I gonna be able to have children? When I first got diagnosed, like, you're so young, you're just starting your life, and suddenly you're faced with like this harsh reality. Oh, is treatment gonna work? Especially when you're first diagnosed and you don't have all the answers. You're like, what stage am I? Am I like stage 4? How bad is it? You don't know your prognosis yet. So just having to like cope with all of that and having all of those thoughts about whether or not I was gonna have a future, and also just having to deal with the possibility of long-term side effects. But I try not to think about that too much just because I want to enjoy the now and I don't want to think too far in the future. Those are probably some of the scariest things, and just having to like think about that when you're 18 years old. What to do with school/study. So I've heard multiple things. Some of my friends have taken a couple classes during treatment. Me personally, I just decided to cancel my college plans I had for the year, and I just focused on getting better because I had really bad chemo brain. I could like barely remember anything when I was in the hospital, so I took the year off. But you can obviously do whatever you feel is right for you. You can take 1 or 2 classes. I just wouldn't overwhelm yourself because obviously getting better and getting healthy again is the main priority. So just do whatever you're comfortable with. Another person asked, how did you tell your friends? So my family was actually in the emergency room with me when the oncologist walked in and told me. My friends were actually all over at my friend's house because I was planning on going to hang out with them after I was done at the doctor. That didn't happen. So I called my best friend because she was there, and I was like, hey, put me on speaker where everybody can hear me. I told him, I was like, it's cancer. The oncologist walked in my room and told me it's cancer, and everybody was really supportive. I didn't really know what to say. I just told them that, and that I would update them on anything else that night, and that's how I told them. But there's no pressure in telling your friends. Just tell them when you're ready, whatever you're comfortable with. Obviously I was very comfortable with telling people, sharing my story on social media, so it didn't really like bother me. But if you're more of a private person, just do it whenever you're comfortable. It's your decision, it's up to you. So what was the hardest thing to lose with cancer being an AYA? My social life or my hair? One, social life. I remember literally I was supposed to start college 3 days after I got diagnosed. So as I was in the hospital, I had to stay in the hospital for 2 weeks in my first visit because I was getting all my tests done, and then I immediately had to start chemo. As I was in the hospital, sitting in my hospital bed, I was scrolling through social media, seeing all of my friends move into their dorms and meet new friends and start school, and that was really hard for me. The losing part of your social life, that was really, really hard because I'm a very social person. I like being around people. Being forced to kind of be isolated was very, very hard for me. And obviously the physical part of chemo, losing your hair, eyebrows, eyelashes, everything being completely stripped away, that was very, very hard. I felt very vulnerable, felt very insecure. I did not feel like myself, but those were definitely two of the hardest aspects. This next question is a really, really good question. How did you feel being treated at a children's hospital? Would you have preferred being adult? I would definitely have to say that I liked being treated at a children's hospital, but there were also some things that I didn't like. I liked the fact that they had tons of resources that not every adult hospital has, like child life. I was actually able to have a nurse in the IR. They called it an IR, not an OR, when I was doing my biopsy surgery. Since I had to be awake, there was a child life nurse with me that explained everything that the doctors were doing, because I was laying flat on a table and I had a cloth covering my face so I couldn't see my chest and what they were doing. So having that nurse there with me, talking me through it, helped so much. That was a great resource. Another great resource is the therapy dogs they have there. Literally helped me so much, brightened my day when I was inpatient. Every time I saw a dog, I was just so happy. They have music therapy there. I don't know, I just loved the environment, and all of the nurses are so nice. So they just have a ton of really good resources. The only thing that I didn't like about being treated at the children's hospital is that there was nobody my age. It was all little kids. It was hard not being able to make any friends at my hospital, but I did like all of the other things. And I've heard my friends that got treated at an adult hospital say that all of the people there were like older people. I don't want to say old people, but older people, so they didn't really feel like, they kind of had the opposite problem that I did. So I don't know, I think if I had the option, I definitely would be treated at the children's hospital still. Somebody asked how to cope with hair loss. Obviously it's really, really hard. I have some videos about hair loss, so I won't go too in depth. I personally shaved my head to take control. Like, cancer was already taking away so many things for me, and I was like, I'm not about to let it take my hair too. So I shaved it, felt more in control of my situation. I think that's one way I coped with it. But yeah, you can like rock the ball if you want to. You can wear a wig, whatever you're comfortable with. I will say that I felt really, really good to take control over my situation by shaving my head. But again, whatever you're comfortable with, if you don't want to shave it, that's totally fine. Another person asked, does survivorship get easier, or will it always feel like a new normal? Survivorship does get easier, trust me. But when you go through something so traumatic like cancer, it's impossible to go back to how you were before. I think that goes for any traumatic experience someone goes through. Like, you're never going to be the same person again, but that's not necessarily a bad thing. I think I'm a changed person. I have a new perspective on life. I'm a stronger person, obviously, because of what I went through. So I don't think it's necessarily a bad thing, but you'll get used to that new normal. This kind of goes along with the last question. How do you overcome the fear of relapse? The fear of relapse is very, very real. The farther I get into remission, the better my survival rate is. And so the less I worry about relapse. Like, I'm almost 2 years out. Statistics definitely give me a lot of hope and really a lot of anxiety, but obviously I still have days where where I worry about stuff and I'm like, is that normal? Was that a normal pain, or was that like relapse pain? I just kind of have to like have hope and faith that I'm gonna be okay, and I think about how far I've already come. But I think kind of realizing how far you've already come from where you were being diagnosed, going through treatment, that helps me a lot, gives me a lot of hope. And obviously, like I said, the statistics that are in my favor more every single day, that helps me overcome the fear. But it's very real. I just try to take like deep breaths, pray about it if I'm feeling anxious about something. Advice for dealing with feeling like you can't relate to friends anymore / not being understood. I totally understand how you feel, but I think for me, hanging out with my friends that didn't like necessarily understand the full extent of what I was going through, that was a way for me kind of to escape the reality of my situation. They helped give me a sense of normalcy when I was hanging out with them. You know, they didn't treat me any differently, they didn't look at me any differently, because I told them, I was like, y'all, I don't want you to look at me differently. And that's exactly what they did, and I appreciate that so much, because when I was around them, I truly felt like I was back to normal. But obviously they don't fully understand what I was going through, and some days when we were hanging out, I wouldn't be fully present in the moment. I would be in my head thinking about, oh, I have chemo on Thursday, oh, I have a scan coming up, and so that was hard. My advice would be, if you want to talk to them about it, just talk to them about it and be like, hey, I know that you probably won't fully understand what I'm going through, but I just kind of need someone to talk to. And obviously they can't help it if they don't understand what you're going through. And for that reason, I think it's really good to find friends in the cancer community. You can find support groups on social media because they can actually relate to what you're going through. So yeah, that's the best advice I can give you for that. Especially during treatment, does it feel like life after cancer doesn't exist? There were times in my treatment where it was just so hard and I felt like I was never gonna get past it, and I felt like I was gonna be anxious every single day if I was gonna relapse or if life was ever gonna be good again. And there are very hard days, but let me tell you that it does get better. The more days that go by and the farther away I am from cancer, the less I think about it, the less I worry. So it gets so much better. It gets so much easier. It is a long journey, it is a hard journey, but it does get better, and there is so much life to live after cancer. Somebody asked, did I have a PICC line, a port, or did you get to choose? I had a PICC line. I didn't get to choose, but if I did, I think I would choose PICC line again, just because with a port you have to have 2 surgeries, one to get it inserted and then another one to get it out, and plus it leaves a bigger scar. I have one little tiny dot. I don't even know if you can see it from my PICC line. The port obviously would have left a really big scar on my chest, so I'm glad I got the PICC line. I was able to get it out the day I finished treatment. What was the hardest side effect of chemo? I think the hardest side effect was the hair loss, obviously, because it affected my confidence a lot, but I also think it was the fact that all of my counts dropped, so my red blood cells dropped, and when that happened, I didn't have a lot of energy. I'd get like lightheaded really easily, felt like I could pass out, and then my white blood cells would drop, meaning I had like no immune system, so I'd be really vulnerable to infections and sickness. And so during that week where I was neutropenic, I would have to like isolate myself inside. I couldn't see friends, and that was really hard. Very hard physically and mentally, I would say. Having to be isolated and having my counts drop was really hard, and then also the hair loss. How long did it take you to heal from the emotional aspect of cancer? I felt like in a way I was like completely numb and dissociated from my situation. Like I was in total fight or flight mode throughout my whole thing. I was just in shock the whole time, couldn't believe that I was in the situation. And then afterwards I kind of had more time to process what I went through, and so that's where I kind of had to like emotionally heal. And honestly, like sometimes I still get emotional about it when I really think about what I went through, and sometimes I can't believe how well I went through it. I think it's because I've had more time to process it. I think emotional healing doesn't have a timeline. You can be 5 years out of treatment and still have things that you need to emotionally heal from. So I still think I'm healing in some aspects. I think I'm in a really good mental headspace. Like I said, don't think emotional healing has a timeline. Just take as long as you need to. There's no pressure at all. And the last question I'm going to answer is, what's advice you would give someone going through cancer as a young adult? My advice would be to reach out and find a community of people. It is so hard to go through cancer alone, and it's amazing to have friends that are normal, meaning like they're not going through cancer, to have that sense of normalcy. And it's also really good to have friends in the cancer community that you can reach out to and you can talk to when you need to vent, when you need advice, when you need some help, whatever. Don't go through your cancer journey alone. Find a community of people, because that is just so important, and that is one thing that helped me so much. So that is all I'm going to answer for this video. I am so excited. It's AYA Cancer Awareness Week. I'm going to be posting about it on my social media, so make sure you follow me on Instagram, TikTok, all those places. If you feel led to donate and to help for AYA Cancer Awareness Week, you can donate to the Leukemia and Lymphoma Society. I am an ambassador for them. I seriously love them so much, and I was able to share my story for AYA Cancer Awareness Week, so I will have links to donate down below, and you can also check out my story on their Instagram. Thank you all so much for watching this video. I hope you enjoyed it. Make sure you give it a like, comment down below any more questions you might have, and subscribe for more videos on cancer awareness. Thank you all so much for watching, and I will see you next week.